Welcome to Healthcare Virtual Assistant 101. In this course, your three key objectives will be to learn the revenue cycle, gain skills, and choose your niche. In this lesson of the Healthcare Virtual Assistant 101 course, we'll be focused on learning the revenue cycle. In that aspect, we'll be looking at the roles and the job titles within the revenue cycle. A very key step, and what we might call the first step of the revenue cycle in accordance to healthcare, is patient registration. Now, you all might be familiar with the aspect of patient pre registration because anytime you go to the doctor or any type of healthcare provider, you need to fill out paperwork or any accompanying electronic documentation to let the healthcare provider know why you're being seen today. Patient pre registration helps to ensure that patient information is accurate and complete before they arrive for their appointment, reducing the risk of denied claims due to incorrect patient information. Now, a typical title you might find attached to this role of the revenue cycle is called a patient access representative. And yes, you can definitely find this opportunity working remotely or virtually as a healthcare registration assistant. The average salary or the average estimated salary for this role is anywhere from $28,000 to $50,000 per year. Insurance is often obtained through an employer or other method in order to pay for health insurance and other health related costs. When attempting to see a healthcare provider and you have insurance coverage, they need to verify your eligibility. In order to do so, there's typically someone in the revenue cycle called an insurance verification specialist, and they verify insurance eligibility on behalf of the provider. Verifying insurance eligibility before providing services help prevent denied claims later on and allows for accurate billing and collection of co-payments and deductibles. This key step often happens before you even see your healthcare provider. Because of that, it's a very vital part of the revenue cycle as well as any healthcare provider's administrative workflow. You can find an abundant amount of remote or virtual assistant jobs for insurance verification specialists. In the revenue cycle, charge capture can be used to refer to many different aspects, but primarily it's referred to the aspect of accurately capturing the charges for services provided, which ensures the healthcare organization is billing for all the services that they've rendered. This in turn maximizes the revenue. So, oftentimes, a medical coder is presented with the task of charge capture. As such, this role has an estimated average salary of $35,000 to $65,000 per year. Medical coders are one of the most popular roles that are known for being able to work remotely or virtually in the healthcare revenue cycle. Surprisingly, sometimes medical billers perform the task of charge capture. It depends upon the revenue cycle of that particular facility or institution. There are many different varying aspects to the healthcare revenue cycle that can cause a medical biller and medical coder to change roles. Now, claim submission obviously happens after the charge capture. Now, I also mentioned that medical billers and medical coders can sometimes change roles. This is one of those aspects. Typically, the job title for someone who handles claim submission is a billing specialist. Claim submission is important and it has to happen in a timely and accurate manner in order to ensure the healthcare organization is paid for the services rendered. Just like anything else where there's a claim involved, there's a statute of limitations or expiration date on when you can submit a claim. Billing specialists often have a great deal of knowledge and expertise around these items. Therefore, their average salary can estimate between $35,000 to $60,000 per year. Now, from experience, I can tell you that these medical biller and medical coder salaries can vary vastly. Claims processing. Now, you might not be as familiar with this one as a medical biller or a medical coder, but claims examiners often perform the healthcare revenue cycle aspect of claims processing. Their average estimated salary is $35,000 to $70,000 per year. This role can often be exercised working remotely or virtually depending upon the employer. Why is this role important? Claim processing is important because it efficiently and accurately reduces the risk of denied claims and helps ensure timely payment. Now, oftentimes, a claim processing or claims examiner role can take place inside someone who may adjudicate claims, for instance, an insurance payer. However, some organizations possess a claims processing or a claims examiner role in order to help efficiently scrub and submit claims in a clean and accurate fashion in order to maximize reimbursement opportunities. Payment posting is essentially like a bookkeeping function for a healthcare organization. Payment posters, they accurately record insurance payments as well as client or patient payments into the patient accounts. That way, the healthcare organization can properly debit and credit for services that have been rendered. Outstanding balances can also be tracked more accurately once payment posting has occurred. Oftentimes, the job title for this role is payment poster. Sometimes you'll see other things like payment recorder or charge recorder, something that just essentially revolves around payment poster. This is a very popular remote or a virtual job. You can definitely be a healthcare virtual assistant and work as a payment poster. The average estimated salary for this role is $30,000 to $50,000 per year. Keep in mind, this can vary drastically depending upon the organization and the type of organization that you're working for. Denial management is an extremely crucial part of the healthcare revenue cycle. Why is this role important? Managing denied claims helps ensure the healthcare organization is paid for all the services provided and can identify areas for improvement in the billing process. Denial management is crucial to any healthcare organization because it helps to identify revenue leaks. This means a service has been rendered on behalf of a client or patient, and the healthcare organization has not been compensated for it. In order to know when you have not been compensated when you work on a reimbursement system, you have to record the payment or lack of accounts receivable follow up. Follow up on outstanding patient balances helps ensure that the healthcare organization is paid for all the services provided and can identify areas for improvement in the billing process. Prior to this aspect of the healthcare revenue cycle, the denial manager was someone who was reviewing the reasons why payments were not received when the payment poster recorded them. And now, this accounts receivable specialist will follow up to make the necessary corrections or the necessary actions in order to receive reimbursement for the services that have been rendered. Patient collections. This aspect of the revenue cycle occurs once all efforts have been exhausted at collecting any outstanding monies that are due from insurance. Once anything that has been allocated to be cost shared by insurance, i.e., a deductible, copay, coinsurance, patient collections is then the most optimal step in the revenue cycle. Collecting patient balances help ensure that the healthcare organization is compensated for all of the services provided, and it helps to maintain a healthy revenue cycle. Though there are several aspects to the healthcare revenue cycle, and of course, each job role and job title can be expansive and goes much, much deeper than just the essential overview of the role, I hope that you leave this lesson feeling empowered, that you now have more understanding of the roles and job titles in the healthcare revenue cycle so that you can utilize this information to choose your niche as a healthcare virtual assistant.